Hello and welcome. Congratulations. You made it to your postpartum phase. I know you're probably in the feels, and honestly, whether you're 6 weeks postpartum or 6 years postpartum, we are still postpartum. Our bodies carried these wonderful things for 7 to 9 months, and they're just so life-giving, and I'm just so proud of you that you are here. I want to take this time to go over some things, go over core rehab that we can do together. Whether you worked with me when you were prenatal or before you were pregnant, I'm kind of just going to go over some important things to remember, walk you through that core rehab. So just stay with me for the next 10 minutes as I go over things, okay? Number one thing I want us to focus on, not number one thing, but first thing we're going to focus on is neutral alignment in daily life. Okay. A lot of times I will see my clients when they have their babies, they're going to pick their babies up from the crib and they're like, this, is this neutral? No. Neutral alignment means your head, shoulders, so your head, ears, shoulders, hips, knees and ankles are stacked if we're standing up. Okay, so if I'm going to go and pick my baby up from the crib, I'm going to do that hip hinge to grab my baby. Or maybe I have a 6 year old and I want to raise them over my head like this. I'm still in that neutral alignment. We don't want to arch and we don't want to round. Okay, this is really going to protect our core and protect our back. A way I like to remember neutral alignment and vertical stacking is to have a neutral pelvis. Okay, I like to think of them as flashlights. So if your hip bones are flashlights, you want to remember flashlights forward. If I'm arched, my flashlights are pointing down. And if I'm rounded, my flashlights are pointing up. So a good way to remember to be vertically stacked, to have that neutral pelvis is flashlights forward. Okay, so I want you to take that into your exercise, into all day. Say you're giving your child a bath. Do we grab them from the bath like this? No. I want you to squat down in that neutral alignment, pick your kid up and stand. Okay, my shoulders, hips, knees, they're always stacked. If I'm in a hinging motion here, I'm going to keep that back flat. I hope this makes sense. It's just reminding us not to arch, not to tuck, not to round our shoulders, to just be calm in our body and always have that neutral alignment. Now, let's talk about 360 breathing. If you worked out with me before, you probably heard about 360 breathing. This is a form of breath we're going to take into exercise and just daily living. Okay. So I want you to take your hands, put them with your thumbs facing back. Now it's called 360 breathing because not only do we feel it here, but I want you to feel it in your back too. We have a tendency to shallow chest breathe. So we're going to inhale, fill that rib cage. You should feel your thumbs pushing out. So inhale, exhale, like a girdle is being wrapped around your waist. Your navel's going in and up. So you inhale, feel that rib cage expand, exhale, tighten. Now, let's find the 4 attachment points that we're going to be tightening. Okay, so your pelvic floor, I want you to think of your sits bones here. Okay, so you can think of your hip bones, it's really your sits bones. Okay, so find your sits bones, your pelvic floor, your pelvic bone, and your tailbone. So think of those as the 4 corners of a tissue, okay? So on the inhale, we're going to relax. On the exhale, we bring it all together. Inhale, relax. Exhale. Okay, so navel goes in and up, and you're bringing all of those attachment points together, just like we were lifting a tissue. So when we add that to our 360 breathing, we inhale, expand that rib cage, relax, exhale, tighten. This is how we help fix that ab separation that we all have, DR, diastasis recti. It's totally normal postpartum. even 3 finger widths. It doesn't matter. It is normal, but we can get it back together. So inhale, relax, exhale. Imagine you're stopping the flow of urine, you are grabbing a blueberry or anything like that. Okay, so inhale, exhale. This can take some getting used to, but this is a super important part of your core recovery. So, this is phase one of your core recovery. I'm going to have you take 5 to 8 minutes daily doing this 360 breathing and attaching all 4 of those points together as we draw in and up. This is going to help that ab separation. Okay. So, phase one, I want you seated. Okay. We have that neutral spine. You can go like this if it helps you. You can put your hands on your rib cage. Sometimes if you had a C-section, it helps for you to kind of, I know that there's some numbness there. There might still be 5 years later. So I want you to kind of touch that C-section scar, and that might help you make that mind muscle connection. So we're going to inhale, relax, exhale, draw navel in and up. Inhale, exhale, draw navel in and up. Okay, so that is phase one of core recovery. Now, depending if you worked out with me before, depending if you had a C-section, everyone is going to progress at different rates. It does not matter. Sometimes we have a bigger gap, a smaller gap. Sometimes we can progress quicker. Sometimes we have things that make us go a little bit slower, and that's okay. So when I give you the okay, you're going to go on to phase two. So phase one, you're going to take 5 to 8 minutes a day. Ideally twice a day, maybe in the morning, maybe at night, just simply doing this breath in the seated position. Okay. Now, phase two, when I give you the go to move to phase two, we are going to go in a laying on your back position. So you'll do the same thing. You'll plant your heels. This is supine. This is called supine when we're laying on our back. Okay. So you'll plant your heels. Maybe put your hand on your C-section scar or onto your hips. Inhale, exhale, inhale, exhale. Okay. So phase two, you're going to do it on your back, and you're also going to add these 3 exercises: a glute bridge, a heel slide, and a knee lift. Okay. So phase two, you'll start with your 360 breath for 3 to 5 minutes. And then we'll take it into movement. Okay. Let me go over this quickly. You want to exhale on the harder portion of the exercise. Think of your exhale as power or as exertion. So you inhale, you get that body ready. You exhale, use that power. Okay. To protect our core and get everything tight and back together, we're going to exhale through the movement. So let's start with a glute bridge. You're going to plant your feet and you're going to push through your heels. But first, inhale here. Exhale all the way up and down. Inhale at the bottom. Exhale through the movement. Good. Inhale. Exhale all the way through the movement. So that's your first exercise. You're exhaling through the movement. Second exercise is going to be a heel slide, and you're once again going to exhale through that movement. So you inhale here. Exhale, send one leg out and back. Notice how I'm exhaling through the entire movement. I inhale at the top, exhale. And remember, in that exhale, we're feeling like that girdle is being wrapped around our waist. We're activating that core, getting those muscles back together. Inhale, exhale through the movement. Good. Last exercise is a knee lift. So I'm going to inhale here, exhale as I lift my knee all the way through. Inhale, exhale all the way through. Okay, so that's going to be your phase two. When I give you the go to move on to phase two, first you're going to do the 360 breathing laying on your back, and then followed by those exercises, hopefully twice a day, ideally morning or night, or when baby's napping, or when you're on a lunch break. The good thing about these is you don't need any equipment. You can do it anywhere that's clean and safe. Okay. Phase one, 360 breathing seated. Phase two, 360 breathing laying on our back plus the three exercises. Now, phase three is going to be on a quadruped position, or you can also think of it as tabletop position. Okay. Once again, we're going to start with that 360 breath. I'm making sure my shoulders are stacked over my wrists. My booty is stacked over my knees. I'm going to inhale here. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, so I'm going to start phase three doing that same thing, practicing that 360 breath. Now, trust me, I know it can be hard, especially freshly postpartum, to make that connection, but this breath is really going to help you get all of your muscles together, fix that ab separation, and get everything flowing together again. Okay, so don't skip the breath. So after we do about 3 to 5 minutes of the breath, we're going to add in a hip extension. So you're going to inhale, exhale through this movement. Inhale. Now, same side, exhale. So you're going to do a certain amount or number of reps that you choose, just sending that leg out in that hip extension. Once you're done with your right side, go to your left. Good. Now, once we feel comfortable here, since we're in phase three, we've already been doing that core work. We can also do a bird dog. So first you'll do that hip extension. Then we will send the right arm out with the left leg. So I'll inhale here, exhale, all the way through the movement. Inhale, exhale, all the way through the movement. Inhale, exhale. And to take it a little bit further, you can do a diagonal bird dog. Okay, so for the diagonal bird dog, I'll inhale. I'm going to send that leg a little bit to the left and send my arm a little bit to the right. This is really going to challenge the core, but making sure I'm exhaling all the way through it. Okay, then I would do the left side. So you have those three exercises. This is the core rehab program. We have 360 breathing, 360 breathing lying supine, plus glute bridge, plus knee lift, plus heel slide. Once we move on to that is at phase three, it's 360 breathing quadruped or tabletop position, plus hip extension, bird dog, and diagonal bird dog. Now, these phases can take you 2 weeks, they could take you 3 weeks, they could take you 4 weeks. It all depends on how we're feeling. Some things to look out for is coning, okay? When you're doing an exercise and you see that you're coning, that means we need to modify or regress. Now, this breath work and these exercises are actually going to help us heal so we don't have that coning. So that's why it is just so important. I hope this made sense. I'm always here for any questions you have. So please send me your DM, send me your questions. But when you see in the calendar that you're going to do the phase one or the phase two or the phase three, these are the things that I am referring to. Okay. I hope this makes sense to you. And I look forward to hearing from you, you guys. Now, don't be afraid to modify. Don't don't worry about moving quickly. Once again, if we see that coning or anything else, we really want to make sure we're mindful of that, and let me know how it's going.